What's up, you guys? It's your boy Miguel here to give you your daily dose of radiation. In today's video, we're covering common X-ray tech mistakes we see. So to give you context, I'm a night shift X-ray tech. Been doing it for over 4 years. Trauma 3 ER in the great state of Texas. So some of the most common ones I would say is you shoot the patient and it's underexposed or overexposed. So that one will literally come with time, technique, and stuff like that. There's been times where it's more of the newer techs that you'll see it where they're not comfortable with using fixed technique yet. Certain patients, certain body habitus, you need to use fixed technique just so you're able to penetrate more and you're able to get better images, because sometimes you'll shoot it under the basic, just like large patient, medium patient, and it won't be enough. And you'll have to, change it up a little bit, because the worst thing that can happen is you send it off and the radiologist is like, what was this? It's burnt. I can't see nothing, or unable to make proper diagnosis. In certain cases, they'll drag you back to get the same x-rays because the image is not good. So that's a little common one. Running the order under the wrong name is another common one. Sometimes patients have similar names. There was one time where we were triaging a family and every single person, it was like 4 of them, had the same last name and the same similar names. Like they were all with M's. It was very hectic, and all within the same age range. I think it was like some triplets or quadruplets. Like it was very, very hard. Like we had to take a moment and be like, okay, we're gonna take it one at a time. And I think they still messed up. They had like one of the orders or something. They accidentally pulled the wrong one, and it caused problems, but you can still fix it. But that's something that's common. Other times when you're doing morning ports and you're shooting a lot of patients, you may accidentally run it under the wrong name. Once again, so you can easily fix it as long as you catch it before the radiologist reads it. Because if you don't, the radiologist, if they catch it, they're like, hey, this is the wrong anatomy. This is the wrong chest of this patient. Because like the patient has a pacemaker, and on this one he don't. And he's been having the same x-rays the past month at the hospital. So it's common trends you see. Sometimes you'll like go for a foot and it's the left one, and maybe you're busy and you're not paying attention and you place the board on the wrong foot. Sometimes the patients will let you know. Other times as long as you didn't press the button and you catch yourself, you're able to save it. So I've seen it all. I've seen patients, and it's mainly with students, they'll set up the wrong one and the patient won't be saying nothing, and it's until like I'll step in and be like, yo, it's supposed to be the other one. And then the patient's like, yeah. And then I'm like, it looks like you're trying to catch up in a lawsuit, son. But like, it's common things like that. Or sometimes the patient will be like, it's my left one. And then you're like, this is the left. And they'll point at the right one. And you're like, that's your right one. And they're like, oh. So like, sometimes the doctor will put in the wrong order. Sometimes the patient will tell you the wrong body part that hurts, and they ordered the wrong one. So like sometimes you always gotta double check sometimes. Sometimes it's very obvious of which one it is. Other times something will seem very like it will be the right foot, but they're trying to look at the left one for a comparison because they've already done x-rays on the bad one. So you just gotta kind of double check. But usually that's for like people who've been admitted, and like the house doctors will be ordering that. Let's see. When you're setting up the table, sometimes if you don't pull it under the table, like the X-ray table, and you have it still connected to the wall bucky, and you expose, you'll get a blank because it's like exposing, the different, not the table, you're exposing the wall. So you just like swap it out. Sometimes it'll stop you and prevent you from shooting. Other times you shoot it until enough scatter hits the table, then it'll stop. So that's a common one you'll see. Certain equipment, if you angle the tube, you'll have to flip the key or else it won't shoot. Like there's a key where you can override it so it will still expose regardless of where it is on the table and stuff like that. Because usually if you set it up perfectly and you don't have to flip the key, it's the most ideal because where the AECs, the little things are on the table or on the wall bucky, it's for most optimal images. Because sometimes if I've noticed it more with C-spines, if it's not in the right little spot, the images will come out burnt out or underexposed and it won't be as crisp and clean of how you want it. Double checking that you're on the right side of the hospital, because sometimes they'll order West 300 and you'll be on East 300. That's a common mistake you see. So always double check people's names. One time we were shooting someone and we were on the opposite side, same name, same everything, but the only thing that saved us was they were there for an NG tube, and I looked at the patient and I'm like, you don't have an NG tube. So we didn't end up shooting it, and then we left the patient's room, and then we looked at the where we were, and we're like, oh, we were on the wrong side of the hospital, and we ended up going to the other one, and the patient did have an NG tube, and we're like, well, look at there, same, like literally same name, same everything, and the only thing that was different was like the date of birth, and that was wild. Same, like I said, female, same about the same range of age and everything. So you always got to be safe and double check stuff because you never know. The worst case that can happen is you shoot the wrong one. Can't take that back. Can't take back the irradiation if you shoot the wrong patient. So I'm trying to see what else we got. I think that's all the stuff I can think of on top of my head. Some of the more common mistakes. For the most part, everything can be fixed with time. I mean, the only time that I'll be struggling a little bit more is like night 7. I didn't sleep, shitty week, and my brain had to think a little bit extra hard. Can't confirm nor deny naps and work, and your brain be a little foggy, and you'll look at it, the order, and you're like, you have to like double look at the order. Sometimes that happens. So always, you can check out my channel. I educate you in the beautiful field of radiology, and we'll see you in the next one.